Good evening. I'm here with Eileen Brennan, the Chief Operating Officer for Montefiore Medical Center in New York. She's here to talk about some recent successes that she's had in implementing a program there. Thank you so much for joining us, Eileen.
Thank you so much for having me. I'm so excited to be here.
Good. Can you describe the conditions and the culture of Montefiore when you first started as Chief Operating Officer?
Sure. When I first started at Montefiore, it had about an $850 million budget. There were a little over 1,000 beds, and we were just at the national benchmark for many of our goals. And we had about 50,000 discharges a year. And in addition to Montefiore, we had 2 other tertiary care centers, 30 primary care centers, a home health care organization, and a joint venture with physicians.
Wow, very
Yeah.
large. I've heard that from day one on the job you had 2 main goals. One was to increase the growth over the whole organization and also for making it more customer focused. How in the world were you able to accomplish both of those goals in such a short amount of time?
Well, we set out with 2 strategies. Be all things to some people and be some things to all people. So that was pretty easy.
Mhm.
You know, that's a simple thing. And then one of our next strategies was called GRIP. And you already hit on one of those topics, which was growth. We wanted to grow our market share. We wanted to rebalance our clinical and our research activities. And we wanted to create a better infrastructure in the facilities, with our IR structure, and with the actual technology. And then finally, we wanted to increase our performance. And we created tools around that so that we could measure it.
So this all culminated in the balanced scorecard.
Yes.
Okay. Can you describe in layman's terms the balanced scorecard and what it is and how it works?
Sure. A balanced scorecard is much like a report card is for a student. And we had it divided into 4 different sections. Patient satisfaction, where we measured how we were perceived by our patients. Employee satisfaction, which is really important because we know that if our employees are satisfied, then we're going to have better patient satisfaction. And we did that by surveying. And then financial goals. You know, we can't maintain our market share if we can't be financially solvent. And then finally, quality, which would be things like length of stay, mortality, morbidity, infection rates, those type things. And we put that into a spreadsheet, as it were, and then tracked it monthly, but quarterly we looked at where we are. And quarterly we had a designation, red, yellow, or green. In green we met our goal, yellow we were nearly there, and red we didn't meet our goal at all.
Oh, interesting. Very intense, it sounds like,
Yes.
tracking very many measures across the various goals. How did the implementation of the scorecard change the climate at Montefiore, or did it?
Well, the implementation did change the climate. And how we went about implementing our plan is first of all, we educated our staff. We gave them a set of tools. We met with them so that they would know what the expectations were and how we were going to measure them. And then the frontline managers pushed that down to their staff, and then from the director level up, we incentivized with a performance incentive goal.
Interesting, interesting. So it's worked out well for you.
It has worked out well because now we know who we are and where we're going and how we're going to get there. And everyone knows that, not just the executives.